Good day, everyone. I'm Bill Dombey, President of the National Association for Home Care and Hospice. Thanks for joining me today for a brief update as to what's going on in Washington, D.C. $30 billion is what's happening. It's the release of the first phase of the $100 billion emergency fund intended for healthcare providers as part of the CARES Act. The $30 billion was distributed starting on Friday to all Medicare providers of services at about 6.2% of their 2019 Medicare fee-for-service revenues. The next phase will look at Medicaid and other payers of services relative to release to healthcare providers, but it's not decided when or how much of that fund will be used for that purpose. The purpose of the funds is to protect providers of services and maintain their operation throughout the COVID-19 emergency. These are not repayable emergency funds. Instead, you will need to be accountable for them, tying them to your direct and indirect COVID-19 costs, as well as lost revenue. In addition, the Small Business Administration Loan Program began operation, and home health care agencies and hospices and other businesses across the country have submitted application for these funds. Home health agencies and hospices are among those who have started to receive these funds. These are loans, but the loans are forgivable to the extent to which you maintain employment of your staff. But the week also showed something, which is life goes on, and that was demonstrated through the release of the proposed rule for fiscal year 2021 for hospice services. There's nothing really dramatic in that, and stay tuned this week at NAC for more detail on it. But among the things that are there are the inflation update at 2.6%, as well as changes to requirements for the wage index with a cap on negative changes of 5% because the changes are quite significant. And CMS stepped in further with some information regarding the addendum to the election of benefits. This is an important time for hospice and home health in another regard, and that is the red tape that continues to cause paperwork burdens for providers of all type, and CMS has issued another round of relief relative to red tape. Home health and hospice have some of that. We'll be providing you much more detail as the week goes on, but for home health, for example, it will allow occupational therapists to be part of the initial assessments of patients. And I also want to thank you all for your participation in the nationwide survey. Your responses were incredible in terms of volume and swiftness, even over such a holy day and holiday type weekend. We now have good information regarding what kinds of priorities you would like us to move on before Congress and the regulators as things continue to move forward. For example, we will be asking Congress to increase payment rates for home health agencies. Included within that would be eliminating the 4.3% budget neutrality adjustment. As you can imagine, behavior in 2020 is not what anybody could have predicted. We've seen from the survey an increase in LUPAs, a reduction in patient admissions, and referrals from both hospitals and community services are down. That is going to create a serious risk to the continued viability of home health agencies, and we need to pump up the rates in order to keep the delivery system operational. In addition, we'll be moving for an extension of the rural add-on, a restoration to the full 3% this year. But the survey also demonstrated one major factor that we need to attend to, and that's PPE, personal protective equipment. Everyone has said we're short. 44% of respondents indicate that they have less than a 10-day supply. So we'll be asking Congress to help put home health and hospice as a priority in the release of any of the stockpiles of PPE. Currently, there are places where more patients are being cared for that are COVID-19 positive by home health agencies than by hospitals. And speaking of red tape, as we did earlier, we asked CMS, but we're also going to ask Congress to relieve home health agencies of the requirement that they have signed and dated orders from a physician before they can bill. Physicians' offices are closed everywhere. Doctors are issuing verbal orders, but tracking down the physician to get signed orders is really asking too much during this emergency. Last but not least is telehealth. We didn't get what we wanted. We made a dent in CMS's view towards telehealth in home health. They seem now to have embraced it. Well, now it's time for them to pay for it. Home health agencies are using telehealth to reduce risks to patients of transmission of COVID-19, reduce the level of use of PPE, and to empty beds at hospitals so that people who need an ICU level of care can find space in that hospital. Home health can and is doing its part to care for COVID-19 positive patients. Telehealth is one of the best tools that they could have. So we'll be making another run at getting payment for those valuable telehealth services. So that's the short story for what we have as an update from Washington, D.C. You can count on NAC to keep you totally informed as to what's going on, from the CDC information to the Department of Labor, the Small Business Administration, the Internal Revenue Service, and of course, CMS and Congress. Thank you for spending some of your time today with me. Stay safe, stay healthy, and stay strong.